Hi, I'm Kiana Howard, SPN, and today I will be administering a sub-Q injection. So the 5 sites for a sub-Q injection include the upper back, anterior to your upper arm, no, posterior to your upper arms, the abdomen, the upper buttocks, and anterior to your upper thigh. So those are the 5 sites, your 5 options for giving a sub-Q injection. So after that, I would verify the doctor's orders. I would check my patient for any allergies, and then I perform hand hygiene. After that, I would gather my supplies, and they are gathered right here on this table beside me. And after that, after I had everything laid out, which again they already are, I would identify the medication that I'll be giving. And today I'll be giving Novolin. If there was a need for it, I would show the calculation, which I did anyways, but there was no need to make this calculation because I already have the syringe that is needed in this scenario. But you would state your medication before administering it, immediately after you've prepared it, and again once before you give it to your patient. So next I will prepare my medication, which I'm doing right here on this table. So I'm checking the medication again, which is Novolin, and I'm checking for any debris around the bottle and making sure that it is not expired, which it isn't. And I would take off this metal cap, but I cannot do that with this vial. So next I would take a alcohol pad and clean the top for 30 seconds. I will let that dry. Then I will take my syringe, and I need 10 units for this scenario. And I have did 10 units of air. Here it is, 10 units of air here. So I will inject this air into the vial. And I will now draw the 10 units of medication. Here are my 10 units. And now I will do the scoop method to cap the needle and syringe. Now that my medicine is successfully drawn up, which is again at the 10 units, mark, there it is, and I'm ready to proceed to my patient's room. So upon entering the patient's room, I will provide privacy. I would ask the patient to state their name and date of birth while also checking their ID band. I would recheck for allergies, and I would perform hand hygiene and don my gloves. After I've chosen the site, but you rotate your sites. I don't think I mentioned it earlier. You rotate your sites due to skin integrity. You don't want to keep picking the same location because that can cause skin breakdown. So that is why we rotate the 5 injection sites when giving a sub-Q administration. So after I've chosen my site, I will then clean it with an alcohol pad. And again, I'll be using an orange. So I'll clean it with an alcohol pad for 30 seconds. Put the patient in a comfortable position and get my needle ready. Here it is. This is my dominant hand holding it like a pencil. And I am squeezing the skin 45 to a 90-degree angle. And I am injecting the medication, pulling that out. And you will pat the injection site, not massage it. I would then put on a Band-Aid or a cotton ball with tape on my patient. I would reposition them in a comfortable position and leave out of the room. After administering the medicine, I would then put a safety cap on the needle and put it away in the sharps container. I do not have a sharps container at home, but if I had one, that's where I would put the needle and syringe. After that, I will then remove my gloves, perform hand hygiene, and document the time and location of the drug that I administered and how much. And that will be all.